Welcome everyone to the 9th webinar of Healthy Me, Happy Me. हमारी सेहत हमारी जिम्मेदारी और ये काम हम सभी बहुत अच्छे से कर रहे हैं, इसलिए a loud clap for all of us. डर के आगे जीत है. हाँ जी, मेरी कैंसर जर्नी का यही मंत्र रहा है. जब मुझे कैंसर डायग्नोज हुआ था और मैं घर पर आके बहुत रोई, तब मेरे 14 साल के बच्चे ने मुझसे कहा, आप 20 साल पहले अपनी मम्मी के कैंसर को याद करके मत डरो. आजकल साइंस, टेक्नोलॉजी, मेडिकल फील्ड इतनी एडवांस हो गई है दैट एवरीथिंग इज ट्रीटेबल. उसने मुझे पहला स्टेप सिखाया, एक्सेप्टेंस टू रियलिटी, और वहीं से मुझे बहुत बड़ी हिम्मत मिली. पहले लगता था व्हाई मी, अब लगता है थैंक्स मी. इस बीमारी के नाम से ही हम सब डरते हैं, लेकिन आज आप सब लोग यहाँ पे आए हैं अपने डर के आगे अपनी जीत को देखने के लिए. और हमारी इस प्रोसेस में हमारी मदद करेंगी हमारी दोस्त डॉक्टर निधि नैयर. डॉक्टर निधि नैयर एक सीनियर कंसल्टेंट गायनेकोलॉजिक ऑन्कोलॉजी हैं इन BLK Max Cancer Center, Delhi. She is a certified robotic console surgeon. She has been awarded with Women of Inspiration Award 2023 on the occasion of International Women's Day. She has authored around a dozen of publications in national and international journals. She has been an active participant in many conferences, cancer awareness talks, interviews, and camps. She has a 12 years plus experience in robotic laparoscopic open surgery for gynecological cancers, radical hysterectomy for cervical cancer, cytoreductive surgery for advanced ovarian cancer, HIPAC, lymph node dissection, screening, PAP and vaccination. आज के इस प्रोग्राम को होस्ट कर रही हूं मैं, विनीता. आई एम अ चार्टर्ड अकाउंटेंट, बैंकर एंड अ डांसर. मेरे साथ मेरी को होस्ट हैं प्रियंका. प्रियंका भी एक कैंसर सर्वाइवर है और IT प्रोफेशनल है विद डेलॉइट. सिमरन शी इज अ प्रोफेशनल स्टोरी टेलर. डॉक्टर निधि के नॉलेज सेशन के बाद हम ऑडियंस के क्वेश्चन आंसर्स लेंगे. ये एक रिकॉर्डेड वीडियो है, रिकॉर्डेड सेशन है, और लेकिन ऑडियंस के डाउट्स हम रिकॉर्ड नहीं करेंगे. हम आपकी प्राइवेसी की पूरी रेस्पेक्ट करते हैं. सो विदाउट एनी मच वेस्टिंग एनी मोर टाइम, ओवर टू यू डॉक्टर निधि. वेलकम ऑन बोर्ड.
Hello, can you hear me?
Yeah, Dr. Nidhi.
Yes, we can hear you, Dr. Nithi, now.
Thank you,
Welcome.
Vinita.
You are
Thanks.
looking very pretty.
Thank you. Thanks for your kind words,
Yes.
Vinita. At the onset, I would like to specially thank you and your organizing team for having me here. You have really taken up this mammoth task of bringing awareness, health awareness among the masses, which is really very appreciating. Thanks. So, good morning all. I am Dr. Nidhi Nayyar and I am a gynae cancer surgeon by profession. I welcome you all today on a bright Sunday morning for this webinar, where I would be discussing about gynecological cancers and breast cancer. My talk would be including the risk factors, the preventive strategies, about the screening tests, about vaccination for cervical cancer, and the most important signs and symptoms which can enable the masses to know when to approach a healthcare professional. So let's begin. Vinita, I'm not able to move my slide forward.
Ma'am, can you just try to stop to share and then start again?
Yeah, sure.
Yeah, now you can share it again.
Is it audible? Can you see the PPT?
No,
No, not yet, Dr. Nidhi.
Not yet.
your voice is audible.
Yeah, your voice is audible, your video is clear.
So
Dr. Nidhi, do you want me to share this PPT for you? And you can keep guiding me how and where to, which screen to reflect on screen.
is it visible now?
Yeah, it is.
Yeah, it is.
But can't I get it on the full screen?
I
You
would.
are able to see the thumbnails as well. Can I move to the full screen? Are you able to see the full screen?
No, we are able to see the presentation itself. So are you using which app are you using? Is this
She's
Power?
using Mac.
MacBook, but it's been converted to the PDF. So you are able to see the thumbnails as well, or just the slide?
We can see the thumbnails also. Maybe there should be an option where you can hide it. Hide the thumbnails and it will give you a full view. On your extreme left, there is an icon.
Yeah.
Yes.
Yeah.
Yeah.
Now we
perfect.
have full screen in front of us.
Yeah. Sorry for the technical glitch.
No problem.
Perfectly great.
So
Perfectly
my
great.
disclosure is, I am not here to scare you, but I am here to make you aware of yourself. Of course, cancer, a word in itself, creates fear among the minds of masses. Whenever we hear about the word cancer, we have this in mind that, oh, it's a dreaded disease. Anyone who suffers from cancer thinks that he or she has been awarded a death sentence. But I am here to tell you that if cancer is detected in early stage, then it can be cured. And so it is important that if there are any preventive measures or there are any screening methods, then all females should be aware so that they can be following those routine tests for screening. What is cancer? As we all know that our body is made up of a number of organs. Each organ has a number of tissues and each tissue is made up of a number of cells, and these cells grow in a very regulated fashion. They multiply. But when this multiplication of cells occurs in an uncontrolled manner, in a haphazard manner, then this results in formation of cancer, and cancer can affect any organ of the body. If we look up at the Globocon 2020 statistics, the number of new cases of cancer in the year 2022 were more than 14 lakhs. And the number of deaths caused by cancer were more than 9 lakhs. So what is the reason for this increased number of deaths? Definitely because of lack of awareness, diagnosis in late stages, not knowing about the screening methods. Here are again the statistics from Globocan 2022, which tell us that among the females, the first most common cancer is the breast cancer, followed by the cancer of the cervix, that is the mouth of the uterus. And the third most common cancer is the ovarian cancer. Now, discussing about all female cancers would be out of the scope of this webinar. So I have specifically limited my talk to the gynecological cancers and breast cancer. If we look at this data, as I told you that the top 3 leading cancers among females include the first most common, that is the breast cancer. The second is the cervical cancer. third is the ovarian cancer. And these three cancers are the only top 3 cancers which are also related for causing increased number of mortality among the females. So gynae cancers and breast cancer, they constitute 50% of women cancers. And the gynecological cancers are the cancers that affect the reproductive organs of the females, which include the uterine cancer, cervical cancer, ovarian cancer, fallopian tube cancer, vaginal cancer, and vulvar cancer. Talking about the first most common cancer in Indian females, that is breast cancer. What are the risk factors which predispose a female to likelihood of developing breast cancer? So the risk factors include advancing age. As age increases, the chances of acquiring breast cancer increase. Then there is, if a female has a family history of breast cancer in a first or a second degree relative, where there are mutations involving the BRCA1 or the BRCA2 genes, which runs in families. So if there is a mutation in the gene, then there is an increased tendency to develop breast cancer. Then onset of menses at less than 13 years of age, which we call as early menarche, and late menopause, that is menopause occurring at more than 50 years of age. So these both are risk factors, that is periods starting earlier than 13 years and periods stopping at an age beyond 50 years of age. Then nulliparity, which means a female who has never been pregnant, or if the first pregnancy is at an age of more than 30 years, or if there is no breastfeeding. As we all know that nowadays women are becoming more and more career oriented, and so the age of marriage is also delayed. And then there is late childbearing. Apart from late childbearing, even when females give birth to their newborn baby, because of the pressing demands of work, they do not breastfeed and join their work early. So no breastfeeding is definitely a risk factor for development of breast cancer. Then coming to hormonal replacement therapy, which is the oral contraceptive pills, or those females who take HRT postmenopausally because of the onset of vasomotor hot flushes, obesity, and increased dietary fat. Yes, obesity is a risk factor not only for breast cancer, but it predisposes to a number of other cancers like endometrial cancer and ovarian cancer. Alcohol intake and radiation exposure. Radiation exposure, particularly to the chest in small girls less than 30 years of age, especially in cases of Hodgkin's lymphoma. Are there any protective factors? Yes. As I told you that obesity is the most common cause for a number of female cancers. So exercise, reducing weight, maintaining a healthy weight, living the sedentary lifestyle can be one of the protective factors. Increasing dietary fiber, increasing the intake of antioxidants, vitamins in our diet, leaving alcohol, going for breastfeeding. As we all had seen that the risk factors were modifiable and non-modifiable, which means that Advancing age being a risk factor, we cannot modify that. If there is a family history, it is again non-modifiable. Early onset of menses, delayed menopause, these are all non-modifiable risk factors. But yes, nulliparity is modifiable. Pregnancy at a young age is modifiable. Breastfeeding, yes, it is modifiable. We can quit alcohol and maintain a healthy lifestyle. Let us see about what are the signs and symptoms which a female can have, which can be indicative of going to a healthcare professional, or these signs which can be indicative of breast cancer. This includes any lump, a mass felt in the breast, or change in the shape or size of the breast. If there is any indentation over the breast, or there are sores on the skin, if the skin is feeling red or there is warm, tender to touch, or there is nipple discharge, particularly if the discharge from the nipple is bloody, or there is dimpling on the skin of the breast, or there are any engorged veins, or if the breast as a whole is having an appearance of orange skin light, then there might be a possibility that yes, you are dealing with breast cancer, and in the presence of all these signs or any one of the signs and symptoms, it is definitely mandatory to meet a doctor. So what are the breast cancer screening recommendations? Breast self-examination should start at 20 years of age and should be done every month by females themselves. The second one is clinical breast examination. This is the examination which is done by a healthcare professional, that is a doctor, your gynecologist. And this clinical breast examination should be done every 3 years between the age of 20 to 40 years. Then we have mammography, which should be done every 1 to 2 yearly, beginning at 45 years of age. And beyond 55 to 75 years of age, it can be done every 2 yearly. Apart from these screening modalities of breast self-examination, clinical breast examination, and mammography, we do have ultrasound screening of the breast, which is preferred in females who are less than 40 years of age. And in special cases, we also have MRI of the breast. So this is a picture depicting breast self-examination, which should be done by all females after 20 years of age every month. And this can be done 3 to 4 days after the periods are over, since this is the time when there is no breast engorgement and the breasts are not tender, because premenstrually, usually there is tenderness in the breast because of the hormonal changes. So every 3 or 4th day, once your periods get over, every month you should develop the habit of breast examination. In postmenopausal females who do not have bleeding, they can set one particular day in the month and the examination to be done on the same day every month. And this includes visualizing yourself in front of the mirror to see for any change in the shape of the breast, then raising your hands above and looking for any dimpling or any change in the skin of the breast, then pressing your hands over your waist to see for retraction of the nipple or any dimpling. The other examination is done in a lying down position with the arm extended overhead and the use of the right hand to examine the left breast and use the left hand for examination of the right breast. And this examination should begin from 12 o'clock position, either in the clockwise or in the anti-clockwise, where you feel your breast tissue with the flat of your hand or the palm, not poking in between the tips of the fingers or the thumb, so as to feel the breast tissue for any lump. Gradually move from 12 o'clock clockwise back or anti-clockwise, and in the end, press the nipple to see for any discharge. You can do this examination while having bath when the hands are already soapy, and so they glide over the breast tissue easily. Now, a word about myths about breast cancer. All breast lumps mean breast cancer is just a myth. It is not a fact. Let me tell you, most of the breast lumps are benign. Particularly in young females, there are fibroadenomas, fibroadenosis, which are benign breast lumps. So any lump does not 100% mean breast cancer, but yes, it does require visit to a doctor and investigation in the form of ultrasound or an MRI, depending on the age. Now, breast injury can cause breast cancer. This is again a myth which is prevalent in the masses. The fact is that breast injury just was a event that caused your lump to be evident. It's not that injury had caused breast cancer. The injury just brought notice of a hidden lump in the breast which was already present. Then underwire bra causes breast cancer, antiperspirant and or a deodorant causes breast cancer. These are all myths and no studies have been documented which support these statements. So these are all false statements. Underwire bra, antiperspirants, deodorants, they do not cause breast cancer, nor do they increase the risk of breast cancer. Then excess sugar intake causes breast cancer is definitely a myth, because excess sugar indirectly causes obesity, increases the weight, and this obesity and increased weight is a risk factor for breast cancer, not the excess sugar intake. Then breast cancer can develop only in the elderly. This is also a myth, as breast cancer can develop even in young females, premenopausal females, and also in postmenopausal females. Female at any age can develop breast cancer. Then breast cancer develops only in the presence of a positive family history. This is also a myth, as only 10% of breast cancers are familial or hereditary, which means that there are certain genes which run in the families and then they cause breast cancer. But remaining 80 to 90% of the cases of breast cancer just develop sporadically, which means that they occur in females who do not have any positive history of family breast cancer. So apart from now breast cancer discussion, which was the most common. Now moving on to the second most common cancer in females in India, that is the cervical cancer. What is cervix? Now, this is a diagram representing the female reproductive system, which consists of the uterus, two fallopian tubes, ovaries, the right and the left ovary, and the mouth of the uterus is the cervix. Cervix is that part of uterus which connects the mouth to the birth canal. Now, why should we all at all be knowing about cervical cancer? What is the importance of knowing about this cancer? The most important reason is that it is a truly preventable cancer. Rest all other cancers, one comes to know when cancer develops. But cervical cancer is the only cancer which can be prevented. Of course, I'll discuss with the screening methods and vaccination and tell you how cervical cancer can be prevented in the subsequent slides. Every 7 minutes, one Indian woman dies of cervical cancer. Why? Why is there increased mortality or death rate due to cervical cancer? Because it is diagnosed in late stage. Females are not aware of the screening methods and vaccination. There are certain social stigmas, religious taboos. Even if they have the symptoms, they do not visit the gynecologist. And so the cancer is then diagnosed in late stage where it is not amenable to cure. What causes cervical cancer? Now, 99% of the cases of cervical cancer, they are caused by persistent infection with high-risk strains of human papilloma virus. Now, what is this HPV virus or human papilloma virus? It is a very common virus which is acquired through sexual intercourse. Only when this virus remains persistent, then it causes changes in the cervical cells, which eventually lead to cancer. What are the risk factors for cervical cancer? Smoking, early marriage, multiple pregnancies, multiple partners, and females who are immunosuppressed, having AIDS or HIV or sexually transmitted diseases. Malnutrition is again a risk factor. Poor genital hygiene. And lastly, it is the lack of awareness and screening. Now, before we move on to the screening test for cervical cancer, let me tell you what is actually HPV infection. This HPV infection or the infection with human papilloma virus is acquired through sexual contact. About 80% of the women will be infected with human papilloma virus in their lifetime. But you should not be afraid of that. This HPV infection is often asymptomatic. And 80% of the females, they remove this virus because of the immunity of their body in subsequent 2 years, which means that in 80% of the cases, the infection with human papilloma virus resolves in next 2 years. But only in 20% there is persistent infection wherein the virus is not removed by the body from the cervical cells. In those 20%, it then remains persistent and then this virus causes changes in the cervical cells. these changes are known as precancerous changes. So screening methods help to find out these precancerous changes so that if we treat the precancerous changes, cervical cancer will not develop. And the time interval between infection with HPV virus and the development of cancer is of the order of around 10 to 20 years. So we all have this window of opportunity wherein screening methods can be introduced and precancerous changes can be detected and treated. Now, what is screening actually? What is the meaning of a screening test? Screening test is a test and examination which is done to find a disease in person who doesn't have any symptoms. And screening test is not a diagnostic test. So it is very important that you all must be knowing that screening test is done in healthy population who do not have any symptoms. Now, there are two tests for screening of cervical cancer. One is the PAP test and the other is the HPV DNA test. Now, both these tests are painless tests and they can be done easily during a normal gynae checkup in an OPD environment only. They do not cause any pain. In PAP test, the cells are taken from the cervix and then they are smeared on a glass slide and then they are examined under a microscope to see whether any changes are there in the cervical cells caused by the HPV virus. Similarly, a better version superior to PAP is the HPV DNA test, which has increased sensitivity to detect the precancerous changes. And this can also be done on OPD basis and does not cause any pain. And these are done in asymptomatic healthy population. I have a number of females whom when I advise them to go for the screening, they say that, doctor, हमें तो कोई discharge होता ही नहीं है. So why should we at all be going for screening? Because when we tell them कि ये बच्चेदानी के मुंह यानी cervix से पानी की जांच है, तो they say हमें तो कोई पानी जाता ही नहीं है, तो हम screening test करवाएं ही क्यों? Okay. So if PAP or HPV show any changes, then a woman is subjected to colposcopic examination, wherein the cervix is visualized under magnification and certain dyes are applied to see if there is any suspicious area over the cervix, and from that suspicious area then a biopsy is taken. What are the screening recommendations for cervical cancer? The age group for screening is between 21 to 65 years of age, which means that no screening is required at less than 21 years of age and more than 65 years of age. The ideal way to get yourself screened between 21 to 29 years is a PAP test only, which is done at an interval of 3 years. During this age group of 21 to 29, HPV DNA test is not done because of increased frequency of HPV infections through sexual intercourse in this age group, which eventually the body will eliminate in next 2 years. So HPV DNA test is not done at less than 30 years of age because already the chances of infection are there, which the body eliminates. Beyond 30 years, pap test can be combined with HPV DNA test. And so this is known as co-test. When pap test is combined with HPV DNA test, then the screening interval between the two tests is increased to 5 years. A pap test to be done every 3 yearly, but once you combine with HPV DNA test, then every 5 yearly. Now, are there any vaccines for prevention of cervical cancer? Yes, definitely. Just as we have the vaccines for measles, mumps, rubella, tuberculosis, diphtheria, pertussis, and recently we even had the COVID vaccine, we similarly have the vaccines which are against the HPV virus. There are two types of vaccines. One is a quadrivalent vaccine, which is against 4 high-risk HPV strains. The other is the Gardasil 9, which is against 9 high-risk HPV strains. India has recently come up with its own indigenous quadrivalent vaccine known as Cervavac. And this Cervavac has been produced by the same Serum Institute of Pune, which has come up with the COVID vaccine. At less than 15 years of girls, 2 doses of the vaccine are recommended. And beyond 15 years till 45 years of age, 3 doses of the vaccine are recommended. As I told you that the vaccine is against HPV virus, and the HPV virus is acquired through sexual contact. So the maximum efficacy of the vaccine is prior to sexual contact, which means that young girls between 9 to 15 years should be given the vaccine. And screening tests, PAP or HPV, they are not mandatory prior to vaccination. This HPV vaccine can be given even to lactating mothers without any detrimental effect on the health of the mother as well as the baby. But the vaccine is not recommended for pregnant females. And yes, this HPV vaccine can be given to boys as well. In India, a number of pediatricians are now giving the HPV vaccine to boys as well. Abroad, in US, yes, it is routinely being given to boys also because these prevent infection with the warts, genital warts, and also provide protection against penile cancers. The most important thing is to know that screening with pap smear and HPV DNA test should continue post-vaccination. So the routine screening protocol has to continue. You've taken the vaccine or your daughter has taken the vaccine does not mean that she does not require subsequent screening, because there are 1% chances of cervical cancer which are not caused by HPV virus. And secondly, cervical cancer can be caused by those high-risk HPV strains which are not covered by the vaccine. So definitely post-vaccination screening should continue. What are the symptoms of cervical cancer? As I told you that in the precancerous stage, which can be detected only through screening PAP and HPV, there are no symptoms at all. Other symptoms include abnormal vaginal bleeding, bleeding in between periods, bleeding after intercourse, or there can be post-menopausal bleeding, that is bleeding which occurs after menopause. There can be abnormal discharge through the vagina, especially a foul-smelling discharge, pain in back or lower abdomen, and also bladder or rectal symptoms in the form of increased urinary frequency, diarrhea, constipation. But these bladder or rectal symptoms occur only in the advanced stages of cervical cancer. Now coming to the third most common cancer in females, which is the ovarian cancer. Now, this ovarian cancer is known as a silent killer. Why? Because the symptoms which it causes, like bloating, excessive gas, abdominal distension, dyspepsia, indigestion, difficulty eating, or feeling full very quickly. For all these symptoms, females usually go to a gastroenterologist or a physician and they are prescribed antacids. So if these symptoms persist for more than 2 weeks, they are not responding to the antacid medications, then such females should definitely get at least an ultrasound of the abdomen to look at the ovaries. What are the risk factors for ovarian cancer? Early menarche and late menopause, as was in breast cancer. Similarly, the risk factor for ovarian cancer is when periods start early, less than 13 years, and a menopause occurs late at more than 50 years of age. BRCA1 and BRCA2 gene mutation in the genes which run in families are responsible for causing both breast cancer and ovarian cancer. Endometriosis, long-standing, is a risk factor for ovarian cancer. Advancing age, females who have never been pregnant, postmenopausal hormone replacement therapy, and yes, obesity, increased weight gain. These are risk factors for ovarian cancer. Are there any protective factors? Yes. Oral contraceptive pills, the combination of estrogen and progesterone pills, which prevent ovulation, they are protective for ovarian cancer, and pregnancy and breastfeeding are especially important and protective for ovarian cancer. Unfortunately, for ovarian cancer, we have no screening test. Just as we had PAP and HPV DNA test for cervical cancer, for ovarian cancer, there is no screening test. An ultrasound done today may be showing normal ovaries, and after 4 to 6 months, a female may develop a full-blown ovarian cancer in stage 3. And one important point that I want to emphasize is that if there is a mass in the ovary, it should never be biopsied. This is in contrast to all other cancers where a biopsy is recommended. In ovarian cancer, if there is a mass limited to one of the ovary, it should never be biopsied. The mass should intact be removed as a whole, because then it upstages an apparently stage 1 cancer to an advanced stage. Now coming to endometrial cancer, endometrium, or also known as the uterine cancer, is the cancer of the inner lining of the uterus, which is shed off every month in the form of menses. So, excuse me. What are the risk factors for endometrial cancer? These include obesity. As I mentioned earlier also, obesity is a risk factor for a number of cancers, including breast, ovary, endometrium. Apart from that, increased BP, that is hypertension, diabetes, all these three, obesity, diabetes, and increased BP, form a syndrome which increases the tendency of developing endometrial cancer. Then hormone replacement therapy and tamoxifen. Tamoxifen is a drug which is usually given to females of breast cancer to prevent the recurrence of breast cancer. But this is a risk factor for the development of endometrial cancer, early menarche, late menopause. Certain endometrial cancers are hereditary as well, which are part of a Lynch syndrome, which runs in families. And long-standing polycystic ovaries can be also a risk factor for the development of uterine cancer. Discussing about the protective factors, oral contraceptive pills, as they were providing protection against ovarian cancer, they do provide protection against endometrial cancer as well. Weight loss, exercise, maintaining a healthy weight is a protective factor for uterine cancer. The most important symptom of uterine cancer is abnormal uterine bleeding, which can be heavy menstrual bleeding, or it can be intermenstrual bleeding, bleeding in between two periods, irregular vaginal bleeding, or it can be a postmenopausal vaginal bleeding, that is bleeding which occurs after menopause. So all these females who have abnormal uterine bleeding should definitely go for an endometrial biopsy. This endometrial biopsy can be done in more than 90% of the females on OPD basis only, where a tissue is collected from inside the uterus. Now, discussing about vulvar cancer. Vulva is the external genitalia or the lips of the vulva, which can be seen externally. It is a rare cancer among females, but if there is long-standing itching, redness, or any growth, or there is presence of ulcer, or there is an area of an altered pigmentation, then definitely one should visit a gynecologist. What can be the cancer risk reducing strategies? So the importance of healthy weight, nobody can negate that. So we should increase the physical activity, exercise, lose weight, stop sedentary lifestyle. We should be quitting smoking, quit alcohol or drink in moderation, eat a healthy diet rich of micronutrients and multivitamins, antioxidants, get yourself screened, and yes, get vaccinated and get your daughters also vaccinated. So what is the take-home message of today's session? As we all know that prevention is definitely better than cure. So go for HPV vaccination for yourself till 45 years of age and vaccinate your daughters. Go for a screening PAP, HPV test, and mammography. And yes, most importantly, maintain a healthy weight. Thank you. Thank you all. So, Priyanka, I think now we can take questions from the audiences.
Yes, Dr. Nidhi. Before that, thank you so much for taking time to share your insights with us today. Your perspective on the subject is it has so much for us to consider and learn, to be honest. Because I am myself a early breast cancer survivor, so I could relate each and every bit to it. And I'm so thankful to you. Okay, we can go.
Thanks, Vinita, and I thank the organizing team for having me here. Thank you.
We thank you, Dr. Nidhi, to take out your time, take out your valuable time in sharing such an insightful knowledge with us, and specifically like talking over this इस subject पे बात करना इतनी detailing में it's I mean, I have no words. ये
Yes.
हमें लगता था कि हमारा सम कॉज वेरी क्लोज टू आवर हार्ट, इसलिए हम ये कवर करना चाहते थे. बट एज अ स्पीकर यू हैव डन full justice to it. Thanks a lot.
Thank you, Vinita. And I must say that you have taken this initiative. This is a very noble gesture of educating the masses. It's really, truly commendable. Hats off to you and your organizing team.
Thank you. I would request all the participants to just, if they can switch on their video for few seconds, we would love to take a picture of your smiling and lovely faces. And then we'll move to the question answers with Dr. Nidhi.
Uh, and now it's time for affirmations. As few of you or most of you know that I do affirmations at the end of the session. So without much delay, let's get started. Before we start, I request you all to switch on your cameras and close your eyes. Again, with a big smile on your face. Say it aloud with me. Uh, my body is capable of healing.
My body is capable of healing.
My health is improving each day.
My health is improving each day.
I'm grateful for my body.
I'm grateful for my body.
My mind feels calm and peaceful.
My mind feels calm and peaceful.
Asking for help is not a weakness.
Asking for help is not a weakness.
I'm learning what my body needs
I'm learning what my body needs,
and how to take care of it.
and I know how to take care of it.
Life is beautiful, and so it is.
Life is beautiful, and so it is.
Okay, you may now open your eyes. I'm sure you guys must have felt wonderful, and I'm sure are feeling energetic too. Okay, we are at the end of the session. I would like to take this opportunity to thank Dr. Nidhi for such wonderful and insightful session, and also our amazing audience who have been with us since the beginning of the session. And this is our ninth session. Thank you so much. You are our backbone. Without you, this is truly incomplete. And my sincere thanks to Vinita ji for this wonderful initiative.
Thank you, everyone. Thank you, Dr. Nidhi. Thank you, all the participants to carve out time and attending our webinars. Thank you, Priyanka. Thank you, Simran. And yes, we have successfully completed 9 webinars, and this was the most important one, which was close to our heart. And we really wanted a good knowledge, which Dr. Nidhi helped us out with. Thank you once again, Dr. Nidhi. Yes, time for a homework. बिना उसके तो मैं कैसे आपको जाने दे सकती हूँ. So my two requests. One, आज हमने स्क्रीनिंग के बारे में काफी कुछ नॉलेज गेन करी. सो आप इवेल्युएट करिए अपनी खुद की पोजीशन, कब लास्ट स्क्रीनिंग हुई है, कौन सी स्क्रीनिंग्स आपके केस में जरूरी हैं. बट प्लीज टेक इट ऑन योर टू डू लिस्ट. आप स्क्रीनिंग के लिए जाइए प्लीज. अपना, मैं ये नहीं कह रही आप इमीडिएट जाइए, बट प्लीज मेक इट पार्ट ऑफ योर टू डू लिस्ट. आप नियर फ्यूचर में जरूर जाइए. सेकेंडली, आपके आसपास में ना सिर्फ कोई कैंसर पेशेंट बट कोई भी ऐसा व्यक्ति है जो किसी भी तरीके की मेडिकल कंडीशन से फेस कर रहा है, किसी भी मेडिकल कंडीशन को फेस कर रहा है, प्लीज उसे इंफॉर्मेशन से बम्बार्ड मत करिए. इंफॉर्मेशन बहुत ज्यादा मत शेयर करिए. वो अपने लेवल पे खुद संभाल लेंगे, उनके डॉक्टर्स हैंडल कर लेंगे. आप सिर्फ उनको इस चीज में मदद कीजिए कि वो नेगेटिविटी ट्रैप में ना आए. बाकी पॉजिटिव रखने के लिए उनको आप अपना कंपैशन, आप अपने कुछ मिनट्स उनके साथ सिंपैथी के दीजिए. दैट इज मोस्ट इम्पोर्टेंट. सो हियर वी आर साइनिंग आउट. हमारे नेक्स्ट वेबिनार्स डिफरेंट टाइमिंग्स और डिफरेंट शेड्यूल्स पे होंगे. उसकी इंफॉर्मेशन हम आपके साथ शेयर करते रहेंगे। एंड थैंक्स वंस अगेन। हैव अ हैप्पी संडे एंड अ हैप्पी वीक अहेड। Thanks a lot. Bye bye. We are signing out.
Thank you all. Bye.